The other condition that we do see in patients with psoriasis is that somewhere around 1/3 of them will actually have concomitant psoriatic arthritis. And so this is something that we ask patients about. We ask them if they have joint stiffness, joint tenderness, joint swelling, focusing primarily on some of the smaller joints of the hands, the wrists, the toes. The reason that this is important is that there are studies that show that early referral to rheumatology and treatment of the disease will actually halt disease progression. So bone erosion is permanent, and when patients have damage to their joints, this is something that's not reversed with treatment later. So it's important that we get them in to see rheumatology sooner rather than later. The biggest challenge in treating psoriasis patients is really trying to make sure that we are approaching the whole patient, that we're looking at this patient and we are understanding what impact their disease has on their life, what impact does it have on their ability to work and their relationships, and also to look at their overall health. So I spend a lot of my time counseling patients about smoking cessation, about weight loss, about diet, and so making sure that we pick a treatment that's going to help to clear their skin, also that's going to help to decrease their risk of some of these comorbidities, and finally that we're working around some of the issues. There's a high rate of obesity in psoriasis patients. This often limits the treatment options that we have, and making sure that they understand this and really motivating them to address these problems. There's more to come. Really, a lot of the development that we've seen are actually in the injectable drugs, the biologics. So this is really a great example of translational science at work. So we understand more and more every day how the immune system works. And psoriasis is just sort of a great example of how the immune system can go awry within the skin. And by understanding kind of the molecular basis of that process, we've been able to actually develop new therapeutics that don't just blanket immunosuppress a patient, but that actually target very specific cytokines that we know are dysregulated in the pathway. And that really seems to be where the future lies. How can we very specifically target the disease process to maximize drug efficacy and minimize side effects?